Hi guys, so welcome back. Before we go into the video, I would like to teach us how to perform a full hand wash. So in the video, I went straight to the point to say I'd perform a full hand wash, but ideally, this is how to say it, and these are the steps as on the screen. So I'll perform a full hand wash following WHO guidelines of hand hygiene. So first of all, I'm going to wet my palms. I'm going to rub an ample amount of soap, rub palm to back of palm, fingers interlace, palm to back of palm, fingers interlace, palm to palm, fingers interlace, fingers interlocked, rotational rubbing of the fingertips to the other hand, rotational rubbing of the fingertips in the other palm, rotational rubbing of the thumb, rotational rubbing of the thumb, rotational rubbing of the opposite wrist, rotational rubbing of the opposite wrist, rinse my hands and dab my hand dry with one paper towel at a time, close the tap with my elbow and discard. For the purpose of the camera, I can confirm that my name is Mavis and I do not know the assessor, and the assessor has not helped me in the preparation towards this exam. Okay, so after performing a full hand wash, that my scene is safe, there is no risk for slip, trip or falls, and there is no danger, and I am happy, and I've provided privacy. So I take my script and I read through what I need to do and who my patient is. Then so I come close to my patient. Hello Leslie, good evening. Hello. My name is Mavis, I'm one of the nurses, and I'm here to perform an ATE assessment for you to check further how you are doing. Is that okay? Alright, but before I go ahead to do that, I need to check your identity to make sure I've got the right patient. Is it okay for me to touch your wristband? Okay, I'll just like to sanitize my hand first. Okay, alright, so I can touch your wristband now. Alright, can you confirm your full name for me, please?
Leslie Roberts.
Can you confirm your date of birth?
The 1st of the 1st, 1960.
Okay, so I can confirm that your hospital number is 100620100. That's nice. Have you got any allergies?
I do. Codeine.
Okay. Can you tell me what happens when you take codeine?
Nausea and vomiting.
Okay, sorry about that. So assessor, I can confirm that I've got the right patient and I'm happy to proceed. So do you feel comfortable? Do you want me to position you in any way?
No.
Okay, are you happy for me to continue? All right, so I'm just going to gather my equipment. This is the call bell by your side. If you need anything, just press the call bell and I'm going to answer to you. Is that okay? All right, so I'm just going to prepare. So I can confirm that I have my OBS machine and that I have 2 different sizes of the BP cap. I can also confirm that my SpO2 probe is connected and there is light in it. I can also confirm that I have my thermometer, I've switched it on and the display is okay, not blocked. I've also got some hand sanitizer and it is in day 2027, so I am happy to proceed. So I'll then perform a full hand wash according to the WHO standard, pat my hand dry and then go close to my patients with my equipment. Hello Leslie. All right, so I am back. Can you still confirm that you are happy for me to continue with the procedure? Okay, so what I am going to do is I'm going to do an A to E assessment. So the first one is going to be checking your airway. When I was talking to you, can you confirm your full name again?
Leslie Roberts.
Okay, so assessor, I can confirm that my patient has been talking in full sentences and she has not had any slurred speech, any gaggle or any reason. So I can confirm that the airway is clear. However, I'll do a second check. Can you open your mouth for me, please? Okay, so I can confirm there is nothing blocking the airway and I am happy to proceed to B. So B is going to be breathing. I'll be checking my patient's oxygen saturation and be checking my patient perfusion as well as respiratory rate to see if my patient is in any respiratory distress. Okay, Leslie, so I am going to confirm a number of things for you. So I can confirm that my patient is not cyanosed, my patient doesn't look pale, my patient doesn't look bluish, and also I am going to check my patient's capillary refill against checking my patient's oxygen. So my monitor is on. I would like to use one of your fingers for checking the oxygen. Which one would you want me to use? Okay, so I'm going to sanitize my hand. Do you feel any pain on that finger?
No.
Okay, can I touch your finger? All right, so I can confirm that there is no rashes, there are no injuries. Have you had any surgery on this hand? So I can confirm that this hand is safe to use and I am happy to use it. Okay, so what I'm going to do is I'm going to press your nail bed for about 5 seconds. If it is painful, just let me know. Is that okay? So I'm going to start. 1, 2, 3, 4, 5.
1, 2. So as I can confirm that my patient's capillary refill is less than 2 seconds, and I am happy to use this hand to check the oxygen saturation. So I am going to put this probe on your hand. It's just going to check your oxygen, but what I need you to do is I need you to keep still for about 2 minutes for me. Is that okay? Right, so I asked my patient to actually keep still for about 2 minutes, because I would use 1 minute for the oxygen and the other minute for respiration, because if I tell my patient that I'm going to check the respiration, she might fidget and it might affect the total results of the respiration. So I'm going to assess for the rise and fall of my patient's chest, and then I've noted. So assessor, I'm going to count this for 60 seconds and my time starts now. So my 2 minutes is up. So assessor, I can confirm that my patient's respiration is full, and it was 21 cycles per minute, that she was not using any accessory muscles to breathe, there was no seesaw breathing, the rise and fall of the chest was okay. Also, my patient's SpO2 is 99 on room air. Leslie, can you confirm if 99 is your normal for SpO2? So I am very happy to proceed. Do you mind if I document now? Do you mind if I write something down? Okay, so I'm going to document. SpO2 is 99, respiration is 21, and then I'll sanitize my hands. Come back to my patient. Okay, so I can confirm my patient is not in respiratory distress, and my patient's oxygen saturation is fine. My patient has enough perfusion, and my patient does not look pale. So I'm going to take this off. Thank you very much. Now I move to C. Assessor, sorry, I forgot in my A, if my patient was unconscious, I would have actually done a jaw thrust to check my patient's airway. And if there was anything lodging in my patient's airway or my patient throat, I would have used the appropriate equipment to take anything lodging in my patient's airway off. And also, if I was in the clinical settings, I would have used the stethoscope to auscultate for heart sounds like crepitus or crackles or anything, or wheezing or respiratory distress. So moving on, I'm going to move on to C. So with the C is circulation. So I'm going to check my patient's heart rate and then blood pressure. But I'm also supposed to do the capillary refill, but because I had done the capillary refill in the breathing, I'm not going to repeat it again. So Leslie, I'm going to need one arm to do your heart rate and then also to check your blood pressure. Which arm would you want me to use? Okay, do you feel any pain in that arm? No. Have you had any surgery in that arm? Okay, so I'm going to touch your wrist and I'm going to check that to check your radial pulse. Is that okay? All right, so I'm going to use 2 fingers. Okay, assessor, I have located my patient's radial pulse, and I'm going to check for 60 seconds, and I am happy to start. My time starts now. Okay, so my 1 minute is up. So my patient's heart rate is 88 beats per minute. The pulse is full, bounding and regular, and there is no problem with it. So I am going to check your blood pressure. I am going to tie a cuff around your arm, and it's going to be tight. If you feel uncomfortable, just let me know. Is that okay? So I'm going to check if there is any cannula or anything, rashes or anything that will make this arm unsafe to use. But as I can confirm that this arm is good and I am happy to use it. So I'm going to sanitize my hand. Now I'm going to locate the brachial artery, so I'm going to palpate for it. Okay, as I have located the brachial artery and I am happy to continue. So looking at my patient's arm, I think this is the right calf side. So what I'm going to do is to bring this 2 to 3 centimeters up the antecubital fossa and make sure the artery liner, artery marker is in line with the brachial artery. So I'm just going to tie that. And then I'm going to put 2 fingers in to make sure that it is not too tight or too loose. So I'm going to start my BP now. Is it okay if I document whilst I'm checking your BP? Yes. So I'll use this advantage to plot my other things on the News 2 chart. Tell my patient to uncross her legs if her legs are crossed, as they would affect the blood pressure, but my patient's legs are not crossed anyway. Patient blood pressure is 120/88. Is that your normal, please?
Yes, normal.
Okay, so I am happy to take this off. Sorry. So 120/88. I am happy. Can I just document and come back to you? Okay, so now that I can confirm that there is no shift in fluid and my patient blood pressure is okay, as well as my patient's heart rate was full and bounding, and I am happy to proceed. So now I'm going to D. I'm going to check my patient's level of consciousness. So can you confirm your full name for me, please?
Leslie Roberts.
Okay, do you know where you are? I know who I am, not my name, but do you know what profession I do or what work I do? Can you tell me, please?
UoN.
That's lovely. Can you tell me what today's date is, please, and the year?
25th March 2015, 2025, sorry.
Okay, so today is the 23rd March 2025, but that's okay because you've been here for a long time, but you got other things correct, so I am happy to proceed. Can you confirm if you are in any pain?
Yes, I am.
Okay, where is the pain?
Abdomen and my shoulder as well.
Sorry about that. On a scale of 0 to 10, with 0 being the least and 10 being the highest, can you confirm?
9.
9. Oh, that's so bad. I'm so sorry. Would you want us to pause for me to get you some pain medication? Okay, so I'm going to escalate to the doctors and then get you some pain medications, and then we can proceed. Is that okay?
Thank you.
All right. Okay. Now, have you had any urine? Have you passed any urine in the last 4 hours?
Yes, I have.
How was it? Was it normal? Was it foul? Was it scanty?
Clear, normal.
Okay, that's fine. Assessor, can you please confirm my patient's blood sugar for me?
5.8.
Okay, so I can confirm that 5.8 is in the normal, so I don't need to escalate it, and I am happy to proceed. So getting to exposure, I'm going to check my patient's temperature. So I've got my thermometer. So Leslie, I'm going to point this thermometer on your forehead. It's going to make a beep. Do not feel frightened or anything. It's just the thermometer working. Is that okay? So I can confirm that the room is not too hot, neither is it too cold to affect my temperature. Leslie's forehead does not have any sweat, no rashes, and I am happy to proceed. So I'm going to point this a few centimeters away. Okay, so I got 37.4 and it is in the normal, so I am happy to proceed as well. As I'm looking at head to toe from the parts visible to me, I can confirm that there are no indwelling devices. There is nothing that I am concerned about. There is no equipment, no bruises, no injuries and anything. Can you confirm the parts that are on scene to me, if there are any bruises or anything at all on the patient or any equipment?
No injuries visible.
Okay, so I am happy to proceed. Leslie, thank you. So I can confirm that my patient's new score is a 0 and does not need any escalation, and I would be able to 6 hours. But because my patient experienced pain and the pain is 9/10, I would have to come every hour to assess the patient's pain and also encourage the patient to engage in diversional therapy as well. Leslie, so I do not have any problem with your observations. You scored a 0, which is very okay. There is no need for me to escalate. I'm supposed to check every 6 hours, but because of your pain, I would have to come back to come and check the medication worked and check every hourly as well. Do you have a particular position that you stay that helps with the pain?
No.
Okay, that's okay then. So just let me know if you need anything. Is that okay? Why she came into the clinic. So do you have a reason why you came into the clinic?
Severe abdominal pain.
Okay, does it affect your mobility or anything?
Yes, it does.
Oh, okay. Apart from that, is there any other thing that causes any distress or any worry for you aside the pain and then your impaired mobility? And this is the call bell. Just press on it if you need anything, and then we will come, and any of us will come and attend to you. Is that okay?
No,
all right, thank you very much. So I'll take my equipment back to the nurse's station or the equipment room, and then I'll make sure that I clean it and then make it clean and for the use for another person to use, and then I'll perform a full hand wash, dab my hands and dry, and then I'll document the rest of my I'll document what I have done for the patient and the rest of my work.